Hello, welcome back to the series Leaving No One Behind in Time of Crisis. Today, we have invited Santiago Botia from the Max Planck Institute in Germany to talk a little bit about how we can use data to understand complex problems. Later, our own Anna Stubendorf from the Agenda 2030 Graduate School will have a look into how food security is being threatening in this COVID 19 crisis. Later, I will speak about how we can use complementary currencies for development aid.
My name is Santiago Otia, and I am doing a PhD in atmospheric sciences. I have data visualization skills, and together with Juan and Ana, we have decided to analyze the current situation from different angles. So I would be using data to understand the current crisis. The COVID-19 crisis has been monitored closely since the onset of the outbreak. Daily cases, deaths, and early case fatality rates were and are currently updated on a daily basis, gathering huge amounts of data. Amongst many, one of the most remarkable examples is the Johns Hopkins dashboard, in which one can see that the geographical extent of the pandemic, shown here, is now reaching every corner of the globe. So to better understand how hard the economy can be hit, we have looked at data from different sources and for previous economic crises. First, I want to start showing that the rapid spread of the virus throughout the first months of this year has brought widespread fears that have impacted the stock market. In the upper panel, the COVID-19 cases are shown for the hardest hit countries. The increase in cases has coincided with a marked fall of the Dow Jones and its equivalent in Germany. In a recent New York Times article, a Harvard economist said, quote, "I feel like the 2008 financial crisis was just a dry run for this," implying that we might be entering into a deep global recession. Let's look now at how unemployment rates have been impacted in the past. Now, looking at countries with strong economies such as the United States, France, and Germany, together with South American countries, we see that past recessions have direct effects on unemployment and income. In the upper plot, it's clear that the unemployment rate after the 90s recession and the 2008 financial crisis had a profound impact on unemployment, with all countries showing an increase. This can be seen more clearly for the 2008 crisis. Income was also affected, with significant dips, mainly in the developed countries. In Ecuador and Colombia, although unemployment increased, it seems that income, already low compared to other countries, was not affected. Let's go now to look if there is a pattern between unemployment and undernourishment. For Colombia, in the early years of this century, the country managed to decrease unemployment rates with little impact on undernourishment. However, from 2010 to 2014, unemployment decreased together with undernourishment, and for the last year of the records, an increase in unemployment did not show impact on the other variable. For Ecuador, we see some interesting patterns as well. The country has decreased undernourishment since the beginning of the century, maintaining, in general, a low percentage of unemployment. But there have been periods in which both variables have decreased together, like from 2002 and 2006, and from 2008 and 2012. Recently, in the latest years, earlier years, unemployment rates have increased with almost no impact on undernourishment. From this, we can see that in these two countries, there is at times a correlation between these two variables. But one of the most important messages of this plot is that unemployment seems to be completely decoupled from undernourishment in developed countries. Even at relatively high unemployment rates of about 10%, Germany managed to keep undernourishment at very low rates. The processes leading from one to the other, from unemployment to undernourishment, are plenty and are probably not linear. So we acknowledge this. But this analysis highlights which countries are more vulnerable to a deep economic crisis that can lead to massive unemployment rates. So, from this brief analysis, we see that it's very likely that we are entering into a deep economic crisis caused by the pandemic. There are indications also that it might be worse than previous ones, leading to a widespread surge in unemployment rates. And finally, unemployment rates can affect access to food, mainly in developing countries, which can have more difficulties fighting into fronts: health and food supply.
My name is Anna Stubendorf. I'm a PhD student in Lund University in the topic of sustainable nutrition. I will talk about food security today. So you can say that there are 4 pillars of food security. The first one is the availability of food. That means having available sufficient quantities of food. The next one is the access to food. That means having the economic and physical means to obtain a nutritious diet. The third one is the utilization of food. That is having adequate dietary intake and the ability to absorb and use the nutrients in the body. And the last one is the stability of the 3 other pillars. The food supply chain is a very complex web that involves both producers, consumers, the agricultural and fishery inputs, processing and storage, transportation, marketing, and other areas. That's not a regional or local issue, but a global one. And this system will be tested during the coming weeks and months due to the COVID-19 outbreak. As of now, there are no major disruptions, but from April and May, the FAO expects that there will be disruptions, and parts of them can be prevented. FAO state that we do risk a food crisis unless measures are taken fast to protect the most vulnerable and keep the global food supply chain alive. To prevent a crisis, we need to understand how the pandemic might affect the food system and which groups that are of greatest risk of food insecurity. 820 million people are suffering from hunger already. Of them, 113 million people are affected by critical and acute insecurity, threatening their life or livelihoods and makes them dependent on external assistance to survive. They cannot cope with further disruptions that the pandemic might bring. Food insecurity increases the risk of malnutrition, morbidity, and mortality. For people affected by COVID-19, good nutrition might make the difference between life and death. Who is at greatest risk of food insecurity? The developing countries and countries going through other crises like the desert locust outbreak in the Horn of Africa or the insecurity in Yemen and Syria. Countries relying heavily on import or export like small island developing states. Small-scale farmers, pastoralists and fishers that might not be able to work on their land or get supplies. Informal laborers will be hit hard by job and income losses in harvesting and processing, and millions of children will not get school meals as the schools are closing. In which way is COVID-19 affecting the food security? First of all, it affects the availability of food because there is a hinder in transportation between regions and countries. The access to sufficient, diverse, and nutritious sources of food might decrease because there are disruptions in the food supply chain. If there is restrictions in transportation, border closures, or quarantines, that affects the farmers' access to markets and labor. It might not be possible to work on their land or transport animals to slaughterhouses. Quarantines and panic during the Ebola virus disease outbreak in Sierra Leone 2014-16 led to a spike in hunger and malnutrition. Restrictions in movement led to both labor shortages and harvest time, whilst other farmers were unable to bring their produce to the market. Hopefully, these lessons can be learned and prevented during this pandemic. The labor shortages affects production and processing of food, especially for labor-intensive farms like agriculture and fisheries in developing countries. Shortage of fertilizers, veterinary medicines, and other input can affect agricultural production. Higher hygiene standards can slow down production, and challenges might lead to increased food loss and waste. During the outbreak of COVID-19, there has been seen some behavioral and market changes. There has been an increase in demand since the onset of the outbreak, and that's in contrast to the financial crisis in 2008, where sales declined. Reduced incomes made sales drop, which led to declining production. During this outbreak, reduced demand in restaurants and hotels can generate market changes, and that will affect the availability and prices. Fear or inability to visit markets and stores has led to increased e-commerce deliveries and a rise in eating at home. Food prices might become higher or lower. They might increase for high-value commodities like meat and fish due to less availability. They may also drop if production is available but demand collapses. The consumption of animals might drop because the fear of getting the virus through eating the animals, and that's not evidence-based. We know that economic slowdowns or contractions are associated in the past with rising levels of hunger. FAO has set 3 recommendations for countries during the outbreak of COVID-19. So countries should meet the immediate food needs for the vulnerable populations. They should meet the need for emergency food, scale up measures to prevent malnutrition, give nutrition support, and adjust school meal programs to provide meals even when schools are closed. Countries should boost their social protection program via social assistance, use of food banks, and facilitate donations from individuals, NGOs, and others. They should also inject funds in agriculture and small businesses. They should enable mobile payment system to prevent disruptions in food supply chains. Digital technologies have a role to play to facilitate the interface between supply and demand, and that can be helpful in trade of perishable products like fruit, vegetables, and seafood. And last, countries should gain efficiencies and try to reduce trade-related costs. They should avoid trade restrictions in order to keep food and feed supplies from worsening local conditions that are already strained by the COVID-19 response. Countries should not hinder trade and mobility of commodities. They should work to reduce food loss and waste, and they should reduce bottlenecks in the logistics and reduce the import tariffs. So hopefully a major food crisis can be prevented during this outbreak.
Hello, I am Juan Ocampo, PhD Fellow at Agenda 2030 Graduate School in Lund University. And today, I want to talk with you about building resilient economic systems through digital financial inclusion. This is part of a blog series called Leaving No One Behind in Time of Crisis. During this pandemic, great amount of assistance aid is being sent to governments around the world. The IMF, for example, has had the greatest amount of emergency requests in their history. Therefore, as Human Rights Watch pointed out recently, transparency and accountability mechanisms have to be strengthened to assure the aid is ending in the hands of the people in need. As it has been analyzed in previous posts, the COVID-19 crisis has an important effect in unemployment, income, and cash liquidity. And these complicated economic circumstances, vulnerable communities are being left behind. To support communities, fundings are being given to states in need of financial support, but the deficient transparency and accountability mechanisms jeopardize the impact of international aid in times of crisis. It is outrageous what unscrupulous people can do, and sometimes the financial aid is snatched from people in hunger and needs. And this should not And let me stress this should not be allowed. Even though financial aid is necessary in many cases, it is important to acknowledge that international support is temporary and the community's local economic capabilities are not always developed, which in many cases leaves these people still dependent in external supply chains and in vulnerable positions. For many years now, complementary currencies have been developed to increase the social and economic resilience in communities. And now, with the emergence of decentralized finance, aspects as accountability and transparency can be enhanced. Through the use of blockchain, lending communities, peer to peer marketplaces, and currencies are foreshadowing a new age in developing aid. One of these cases comes from a partnership between Red Cross and Grassroots Economics, who has been using on chain complementary currencies to incentivize the creation of local supply chains and market loops. And thanks to the benefits of the blockchain, it is able in a transparent way to gather data and analyze the real use of this funding. I want to highlight some aspects of this solution. First, there is up to certain extent a democratization of aid. Communities or capabilities in terms of financial literacy might increase, and there are incentives for developing local supply chains. Finally, international organizations can be better held accountable in how the donor money is used. I want to end this post with four main takeaways. First, there's a lack of transparency and accountability that jeopardizes the impact of development aid. Second, decentralized finance and complementary currencies are important platforms for developing more resilient communities by prioritizing local supply chains, increasing financial literacy, and enabling more traceable impact. Finally, and very important, is to reflect on the ideologies, power structures, and values that these technology infrastructures are embedding and the unintended effects of using them in vulnerable communities. As I So, hello everyone. I want to thank first Santiago and Ana for being here. So, we have been working in this type of blog series now and inviting them to talk about what they think about COVID-19 and the effect this is having in sustainability. Today we have Santiago, who is a researcher, PhD fellow in the Max Planck Institute in Germany. And we have Ana, also a part of the graduate school Agenda 2030 in Lund University. And first, thank you for being here, both of you. And then I wanted to ask Santiago, is something that really bring my attention in your presentation was the last part about unemployment and undernourishment. It's kind of showing some type of relationships which you explain well, but I would like to know, how did you manage to end in that graph? What's the point of that graph?
Yeah, thanks for the introduction and the question. So, as a pure data-driven approach, I wanted to find a variable that can connect unemployment and potential threats to human health. And within those variables, undernourishment seem to be a, a, a logical way to go, because if the current crisis generates high rates of unemployment, then this will generate less income in some families and some populations. And then the idea was that the access to food would be undermined by less income. So that's basically the reasoning behind this plot there.
Okay. So there's two questions that I have now, and the first one is, uh, you've been working with different data analysis and getting sources from different parts, and I would like to ask you is, what do you think it's the benefit of using data as a way of taking decisions or analyzing situations?
Yeah, no, I think is now it's crucial to have data-driven decisions in this crisis because first we can see how things are evolving in different countries, and for countries that have not yet a big outbreak, they can learn from what is happening elsewhere. That's like one of the things. And also we can monitor almost in real time, actually in real time, how the cases, the death fatality rates are evolving in time and how the curve is flattened, you know.
Mhm.
So I think this is crucial, and now that we have the possibility of doing this, I think this has been a major role in the current crisis.
Well, there's something that you're saying here is that the importance of data in order to act and take decisions, it's good. From what I know that your research is about atmospheric sciences. There's a lot of news and topics around in the media talking about this COVID is going to have an impact in climate change or in health. Your research is about atmospheric science and looking in the Amazon how this changes. I would like to know a little bit what is that you're doing and if it's true that this COVID-19 could have an effect in climate change.
Yeah. This has been quite a big topic recently, but here I think that we should define first the impacts that COVID is having on the atmosphere. So we have climate change species that are species that stay in the atmosphere for a long time, like carbon dioxide and methane. And on the other hand, we have species that stay in the atmosphere for less time. And these are microparticles, particulate matter, or nitrogen oxides. These, the last ones, the ones that stay less time in the atmosphere, are the ones that are being affected by the COVID, let's say by the political decisions that are making people stay at home, because there is less industrial production, less cars, and these are the ones that are affected. In terms of climate change, I don't think it's easy to say that the COVID pandemic is going to affect climate change, because we are talking, when we talk about climate, we talk about 30 years, long time scales. What COVID pandemic is affecting is air pollution, and daily air pollution in megacities are being like the indices and the concentrations of these short-lived gases are lower. So this is what is happening now. So I think that this is important. And coming to your question, we are not in the Amazon, in the station that we have there, we are not seeing any effects yet on this, because we measure greenhouse gases, so the ones that stay long time in the atmosphere.
Okay, thank you for that. It definitely gives like an idea of how easy, like if you don't know what you're talking about, you can easily start making assumptions of, yeah, this is going to change climate change. And that's, from what I understand, what you're saying, not necessarily that's true. And that brings me to the next question, and this is now inviting Anna to the conversation, is that, well, with this graph of undernourishment and unemployment, or there's kind of an assumption that unemployment has an effect on people getting not enough nutrition. But you've been doing this, researching this, have written books about nutrition before. I would like to know what's your thoughts on this. Is really unemployment and it has an effect, or could have an effect on undernourishment?
Well, the short answer is yes, but there are many ways that they can be connected. One way is, of course, the access to food, as you were talking about, Santiago. And that means that you might not have an income to spend to buy the food that you need. Another way is if societies are closed down, if you cannot work on the land or transport yourself to your working place, then there might not be any food production as normal, and that will affect the availability of food. So there might not be food in the stores, or you might not be able to go to the store and buy the food, and that will of course affect your intake. So that's two ways that unemployment can affect. But also, of course, unemployment is affecting your health. You might get depressed or have other health outcomes, and that will also affect your intake when it comes to nutrition.
Okay, yeah. Well, that's a very good point, and it's also an argument of how you cannot make such clear assumptions when you're looking just to data and a graph. You have to look behind what's going on, and that's a good point that you're giving us, Anna. And the next question I have for you is that, as in the case of this new media and information going around, I heard that now people are being suggested not to eat certain types of food because they could have the COVID, or this could have an effect on their health. And you are working with sustainability and nutrition, and I wondered what's your take on this? Do you think this would have an impact also in sustainability in the long run?
Well, I think there is a rumor right now that if you eat animal products, then you might get the virus. And that's not evidence-based. If you eat like cow's meat or pig's meat, there is no risk of getting the virus. But I do think that if people start adjusting their dietary habits during this crisis, that might actually they might change them in the long run. So even if when this is over, if we get rid of the virus one day, then they might have new dietary preferences, and they will keep on eating more vegetables, more plant-based. But we don't know. That's the short answer on that one.
Okay, but then, because then what you are researching is basically that, no? What you're looking at, and please tell me a little bit more about it, is how decisions in your nutrition are having an effect on your health in later years. Or could you please explain me better what it's that you're doing?
Well, my research is basically about healthy and sustainable food. And that means that I'm researching on if sustainable food is also good for your health. And we know a lot today. We know that fruit and vegetables is healthy for you, and it's also good when it comes to climate change. But when it comes to some animal products, we don't know how the connection is between health and sustainability. For example, fish is one of the food groups that is good for your health, but when it comes to the environmental impact, it can be actually very bad for the environment. So my research is basically about which food groups that are good for both health and sustainability.
Okay. Thank you. I think this discussion has been very interesting for, well, in general, because we're also talking to the people that are getting this a lot of information that not necessarily is true, and then gets us making decisions that are not good.